Hi, everyone, and welcome to our poster presentation on a qualitative evaluation of a universal hepatitis B screening tool at Stanford Primary Care. An estimated 862,000 to 2.4 million people in the United States have chronic hepatitis B infection, with only 30% of people with chronic hepatitis B aware of their infection. Current screening practices for hepatitis B are risk-based, but in conjunction with past studies showing the cost-effectiveness of universal screening, California and the CDC has taken steps for transitioning from a risk-based screening approach to a one-time universal approach for U.S. adults aged 18 and over. In response to this, Stanford Primary Care has implemented a novel health maintenance due hepatitis B reminder tool to prompt providers to discuss hepatitis B screening with patients. In hopes of expanding this tool to other healthcare systems, we sought to understand stakeholder perspectives on the barriers and facilitators of the implementation of this tool.
Our methodology is twofold, as we collected data from surveys and semi-structured qualitative interviews. The participants of our study included 125 providers from various Stanford and UHA clinics. We developed our survey and qualitative interview guide through an iterative process utilizing the knowledge, attitudes, skills, and habits framework. After speaking with key stakeholders interacting with the HM2 hepatitis B screening reminder, we targeted our data collection on 5 focus areas: hepatitis B screening protocols, HM2 workflow, patient reactions and perspectives, HM2 outcomes, and the future of the HM2 tool. We then identified recurrent themes regarding the barriers and facilitators to implementation of the HM2 reminder for hepatitis B screening from survey and interview responses.
4 prominent themes emerged from our study. The first is on underscreening of at-risk groups prior to HM2 implementation. 92% of survey respondents reported that universal screening is more straightforward. Before the implementation of HM2, most physicians would only screen high-risk populations, such as Asians, men who have sex with men, and more, which requires an active mental process. This compounds with the fact that hepatitis B screening is one of many preventative tests that are in many physicians' boards, not on the forefront of their mind. The second theme is on one-click ordering featuring convenience. A green checkbox next to the HM2 reminder that automatically pens a test screening once clicked on by physicians. Only one survey respondent disagreed with the statement that hepatitis B screening one-click order is easy to use, with many physicians expressing hope for the feature to be extended to other HM2 alerts, citing convenience and time efficiency. The third theme is seamless integration to existing workflows. Multiple physicians, when interviewed, reported that their staff were able to adapt to the HM2 implementation without much additional training. While most physicians reported neutral to the statement, my practice's process for responding to hepatitis B HM2 is straightforward, a minority of 40% disagree with the sentiment. And lastly, it's patients' compliance with universal-based screening. 100% of survey respondents reported spending less than 5 minutes discussing hepatitis B screening with patients, with 75% reported spending even less than 1 minute. Moving on to discussions, implementation of the HM2 reminder is consistently shown to increase hepatitis B screenings, which may be cost-effective and life-saving in the long term as the prevalence of hepatitis B in at-risk populations gradually increases. That said, multiple barriers exist, such as the fact that the majority of providers still prefer the risk-based model. 2 prominent reasons from conducted interviews. 1, that the reminder persists even for patients with an immunization history with hepatitis B, and 2, insurance noncompliance and outdated risky lifestyle coding, discouraging providers from screening patients universally. Further improvements are necessary, and thank you for coming to our presentation.